especially the whole grains and beans that are commonly recommended to be avoided in a cancer-fighting diet. All right, moving on to the last and final myth of this presentation is that a cancer survivor should do everything possible to consume only organic foods as part of a cancer-fighting diet. Now, I first want to say that I am not against organic foods. I think that organic foods can be beneficial to reduce pesticide contamination. Doesn't mean that it eliminates pesticides, and it can have some good environmental importance behind it. However, the first recommendation is always to consume as many fruits and vegetables as possible. This recommendation is more important than whether the foods are organic or not. You see, I have a lot of patients that will come to me that say, they have the fear surrounding the organic foods and will just simply not eat some foods or some fruits and vegetables because they can't get them organically. But we know that the benefit of eating fruits and vegetables, regardless of their organic or conventionally grown, outweighs that risk that we're having. And what people often forget about is that there is a large percentage of the population that doesn't have access to organic foods or doesn't have the ability to afford organic foods. So what does the research say? This was a particular study in 2014 that looked at 623,000 UK women followed for 9 years and found that there was little or no decrease in the incidence of cancer with the consumption of organic food, except possibly for non-Hodgkins lymphoma. Okay, so we're finding in the research that it doesn't necessarily reduce our risk of cancer if we're consuming the organic foods. Now, it's important to note that those who choose organic foods are also more likely to exercise, not smoke, incorporate other healthy lifestyle factors, have higher education, and even more importantly, higher incomes. So they have generally more access and ability to get organic foods, and then also improved access to healthcare. Research went on further. This is a study that was found in a Petri dish where there was antioxidant activity against cancer in the Petri dish was found to suppress cancer cell growth better than conventionally grown produce. So this is something that we're seeing, which is awesome. However, organic produce tends to be up to 40% more expensive. Now, the scientific literature demonstrates over and over again that a diet focused on whole plant foods and a reduction in alcohol, red meat, processed meat has a greater impact on reducing cancer and chronic disease risk. Where the scientific literature does not clearly conclude buying and consuming organic produce drastically reduces our risk of cancer and improves our overall outcomes. So again, before I summarize this one, I want you to know that eating organic foods, is there a possible benefit? There definitely might be. However, what I don't want individuals to do, remember, this goes a lot back to fear, is that there's going to be somebody who has the fear around these organic foods and chooses to eat, let's say, I'm trying to think of, they're going to choose an organic, refined, white pasta. Not to say that can't play a role in our diet, but overeating an apple because the apple is conventionally grown. We know the benefit is to still eat the conventionally grown apple. Okay, so again, this is not the fact that organic foods don't provide any benefit in any way. It's more so that we need to be eating our whole unprocessed fruits and vegetables as much as possible to really help reduce our risk. So the fact is that the scientific literature demonstrates over and over again this whole plant-based food approach, and that we should always consume as many fruits and vegetables as possible. And this recommendation in itself is more important than whether these foods are organic or not. And again, if you have access and can afford to have all organic food, awesome. That is incredible. However, again, that is not the case for most people. All right, so this summarizes the myths that we were going to cover today. And so I just kind of want to move on and do some final thoughts here about putting it into practice. Now, we didn't necessarily go into a lot of this, but I do want to emphasize the fact that oncology dietitians can play an incredible role in the success of patient outcomes. And as I mentioned before, nutrition goes beyond just nutrition, right? It goes into the fear and the empowerment and so much that goes beyond this. And so I'm really hopeful that sharing some of this information today really helps empower us to eating a diet that's more focused on whole, unprocessed foods, and particularly those plant foods where we see the greatest benefit. But it's also important to note is that patients need to be counseled based on where they are and also where they are wanting and willing to go. Okay, and some individuals, they may encounter a cancer diagnosis and be able to flip their lifestyle 180 degrees overnight. And for others, that is just not as realistic. So it's okay to take small and steady progress moving forward, and also taking into account the resources and tools that are available to a patient. I think sometimes we lose the foresight about what is available to a patient to do. And also our during treatment versus survivorship goals may differ from one another from the standpoint of, let's say someone during the course of treatment is having lots of diarrhea. My goal as an oncology dietitian is to get that diarrhea under control. And sometimes that might mean pausing cruciferous vegetables. Although these cruciferous vegetables are incredibly cancer fighting, we need to help control the diarrhea so that we can tolerate the nutrition and keep the nutrition. And also the standpoint is that cancer changes everything. And as a cancer survivor myself, I know that very, very well, and it changes everything. But if you allow it to be, cancer can be your teacher. And what I mean by that is that it can, for me, it was a big wake-up call. And have I changed some things in my diet since I've been diagnosed with cancer? Yes, I have put different emphasis on different things. However, some of the biggest changes for me have really been some of the other pillars of health that I won't necessarily say that I was avoiding beforehand, but I was not paying as much attention to. And so when it comes to my approach, when it comes to cancer, looking at trying to control the controllables. And when I think about this, I know that I have a genetic mutation. I can't change my genes. I can't change the genes that my kids may or may not have inherited from me, but I can control my nutrition. And there are other factors that I can control too. So here we have the 6 pillars of lifestyle medicine according to the American College of Lifestyle Medicine. So many of these things are also within our control. So obviously, as an oncology dietitian, I am emphasizing nutrition. However, there are so many other important factors when it comes to helping to reduce our risk of developing cancer and chronic disease and also healing from it. So we need to pay attention to our physical activity, our stress management. It doesn't mean that we're never going to have stress, but how we manage that stress, how we carry that load definitely makes a difference in our mental health, but also our physical health. Making sure that we're focusing on restorative sleep, social connection. I think that's a powerful piece that is commonly missed when it comes to our health. And then the avoidance of risky substances such as tobacco and excessive alcohol consumption. These are all incredible pillars of health that we can focus on and control and help focus our attention on when we're trying to heal from cancer or help reduce the risk of cancer in the first place. All right, so I'm back on the screen with you here today so that you can see me. I'm finishing this recording from a very different place where I started it. But what I want you to know is that the key takeaway is that research is not 100% conclusive in nutrition cancer. However, what we do know is that it points to more whole, unprocessed foods, particularly fruits, vegetables, whole grains, and legumes. And my hope through this presentation is, especially if you are a cancer survivor, is to help take some of the fear out of these cancer nutrition myths and put the science into it, and therefore put some empowerment into it, and know that to take steps moving forward, depending on where you are in your nutrition and cancer journey, is truly to aim to focus on more whole fruits, vegetables, whole grains, and legumes. I like to think that I've honed that point in pretty darn well at this point when it comes to the number of times that I've said fruits, vegetables, whole grains, and legumes. And my hope is that you will move forward with less fear and have found a little bit more control in this journey. Now, if you want a little extra help in terms of the journey, I have a little freebie for you called bite-sized plant-powered strength 10 high-protein snacks for cancer treatment and into survivorship. So whether you are aiming to reduce your risk of cancer in the first place, or you're in the middle of cancer treatment, or really trying to embrace this survivorship and looking to add more whole unprocessed plant foods into your diet, I got this freebie for you. You can grab it at www.wholesomeprograms.com/high-protein-snacks, or you can pull out your phone and use this QR code and it will take you right to that website, and so that you can get this downloadable guide. I got 10 different high protein snacks in there. 5 are ones that you can make from home that have a little bit of a recipe to it, and another 5 are ones that you can purchase to make easier. All right, so as I end this presentation today, I want to thank you for joining me and learning with me. If you want to reach out, say hi, learn more about the programs and clients that I work with, you can find me on Instagram at wholesome.cancer.nutrition. I also have a Facebook page, but to be honest, I am not as consistent on being on Facebook, so you'll best find me on Instagram, or of course at my website, which is www.wholesomellc.com. And thank you for the honor to be able to present this information to you. I hope you find it as empowering as I do. Take care.